Have you, a family member, or a patient in your care recently suffered a stroke or a heart attack? These conditions may warrant the use of warfarin. These life-threatening conditions involve large blood clots in the heart, lungs, brain, or other parts of the body. This could stop blood flow, leading to devastating outcomes.
Warfarin, also known as Coumadin, is an anticoagulant, a drug that slows the body's ability to make blood clots. And while it should not be used during an emergency, it can be used to prevent heart attacks or strokes from happening.
Forming blood clots are useful to stop bleeding in the body. However, when large blood clots form, it can cause severe outcomes such as a heart attack or a stroke. Clotting factors are the key in developing blood clots in the body, such as vitamin K-dependent clotting factors. Vitamin K-dependent clotting factors can only be produced with the presence of vitamin K.
Warfarin suppresses the formation of clots by interfering with the enzyme that activates vitamin K. Without vitamin K, there will be a decrease in production of vitamin K-dependent clotting factors, which will then inhibit the formation of clots in the vessels and slow down the formation of small clots that are already present. Warfarin can increase the reduction of vitamin K-dependent clotting factors by 20%.
Warfarin can be used to treat patients with pre-existing blood clots such as DVT or pulmonary embolism. Patients with atrial fibrillation or a prosthetic heart valve are at high risk of forming blood clots. Warfarin is used to prevent the formation of blood clots that may arise in these health conditions. Warfarin can also be used as a management of myocardial infarction.
Warfarin interacts with many drugs. Some of these include heparin, aspirin, and acetaminophen. It's important to know as a nurse and to educate the patient that if these are combined, there's an increased risk of hemorrhaging and bleeding.
Some side effects of warfarin include bleeding. Watch out for signs of bruising, hematoma, dark stools, discolored urine, low blood pressure, and headache. Do not take warfarin if you are pregnant or breastfeeding.
Stop! Avoid eating foods that are high in vitamin K when taking warfarin because they counteract the effects. Also avoid drinking alcohol because it can cause bleeding.
Okay, so fun fact, where does warfarin originate? Well, warfarin splits up into WARF, which stands for Wisconsin Alumni Research Foundation, where the drug was studied and based from, and then it breaks up into Arin, which derives from Coumarin, which essentially means blood thinner. So we know that warfarin is a blood-thinning agent founded and based in Wisconsin.
Although warfarin is considered an anticoagulant, you may be surprised to hear that it was originally used to kill rats. It became approved for human use in 1954.
If you think warfarin is the drug for you or your patient, contact your provider today.